So SSI is a significant provider of refugee and asylum seeker services in New South Wales. In 2014 and 15 we supported over 10,000 refugees and asylum seekers to integrate into the Australian community. We noticed that lots of refugees and asylum seekers struggled to make the transition into the community because they had had previous experiences of trauma, and the transition to Australia can be very difficult for people. Many of our staff are from multicultural refugee backgrounds themselves, and many of them have had limited education about mental illness. So we needed to have a strategy that included assessing for client needs, but also helping our staff to be comfortable to talk about mental illness with their clients. The questionnaire we ended up choosing to adopt was developed in America by refugee organisations, where they worked with refugees to identify language that worked in an assessment tool.
This diagram is a distress barometer.
Many refugee communities don't have words that we use for mental illness. Since we've started the assessment back in April 2014, we've assessed about 7,500 individuals, and of that group of people, about 36% were assessed as needing a referral to a mental health service.
About a 7. I could certainly refer you to...
We looked at our referral rates to psychological services before and after starting the screening tool, and what we found was that the referral rates from our case managers doubled. And as a result, we've engaged in partnerships with organisations like UNSW and Beyond Blue and Movember to try and develop tools and to develop data and evidence that help us to better respond to this client group.